Hey everyone, welcome to Only for Teens on Talktoradio.com. On today's program, we'll be talking about stress with Dr. Nita Shaked. Thank you for being here on the program once again, Dr. Shaked.
Thank you.
So what are some of the biggest stress factors in a teen's life?
There are so many factors that can stress a teen out. Problem with friends, difficulties in school, school demands or extracurricular activities that are too demanding that a teen can't manage. Taking on too many commitments or taking on too many after-school activities. Family life can be a stressor, whether parents are going through a divorce or changing jobs, or maybe parents are having some financial difficulties, maybe a new sibling being born into the family, maybe parents remarrying. All those can be stressful for a teen. Teens can be stressed out also by negative thoughts and feelings about themselves, given that they're teenagers and that they're going through a lot of hormonal changes.
Right, low self-esteem?
Yeah, low self-esteem, feeling like they're not doing well enough, having high expectations for themselves.
Okay.
And teens can also be stressed out by poor body self-image, meaning that they don't like their body, they don't like the shapes that their body is taking, because as you know, teenagers' bodies change quite a bit.
Right.
Teenagers can also be very stressed out by things like moving or changing schools. Even if it's going from middle school to high school, which is a new school altogether, that can be very, very stressful. Lastly, teenagers can be stressed out by parents separating or divorcing, as we talked about earlier, and also by parents remarrying.
And how does the stress negatively impact them both emotionally and biologically?
Well, some people react to stress well. Most people react to stress poorly, which is why we all need to learn how to manage stress, right?
Right.
So sometimes teenagers might become overloaded with stress. And what I mean by overloaded is that they can't function well. They might not be sleeping. They might be sleeping poorly. They might have difficulty falling asleep or difficulty waking up in the morning. They might not be eating well, or they might be eating too much because they're so stressed out. They might have a range of emotions, feeling like they're very anxious or feeling like they're depressed, feeling like they're stressed out, because they are, right? They might feel very angry, or they might feel, very overwhelmed with all these emotions because they're so stressed out and they can't seem to get out of this rut.
And they just don't know what to do.
Right. And so some teenagers might withdraw because they're so stressed out. They might stop hanging out with their friends, or stop going to their favorite after-school club, or not participate in activities. And some teenagers might become really aggressive. They'll pick fights with their parents, or they'll pick fights with their best friends because they can't cope.
And are there any, apart from those, are there any other types of reactions they have towards the stress, any other common reactions?
I think those are probably the most common reactions. If they're seeing anything beyond that needs additional intervention, please go see a psychologist if you're suffering and you can't cope and you're feeling like your reaction is abnormal.
And how do those reactions exactly worsen the situation?
If kids pick poor ways to cope, like for example, turning to alcohol or illegal drugs, that can make the situation much, much worse. Alcohol and illegal drugs do not fix what's stressing you out. They just temporarily put a Band-Aid on whatever is stressing you out. But then you have to come back to that stressor again, now hungover or after withdrawing from drugs or alcohol.
Right, and they might have an addiction, or they might develop an addiction.
Correct, right. So those are not healthy coping mechanisms at all.
What would you say are healthy coping mechanisms?
Well, actually, I do want to highlight that there are a lot of ways to cope with stress. And I want to give you a list of different tools so that you can implement them in your life. So first of all, I want you to be able to practice relaxation breathing, okay? Relaxation breathing is the ability to breathe in and feel the air go all the way down to your tummy and breathe out. And when you breathe out, I want you to breathe out all the toxins, okay? I want you to really release all the negative thoughts and release all those stressful things. Another tool for managing stress is to develop assertiveness training, meaning saying things that you need to say without being aggressive or passive. For example, you can say, I really feel angry when you yell at me all the time. Okay, that's being assertive. That's communicating to somebody else how you're feeling. Okay, I want you to learn how to decrease negative self-talk. Okay, I don't want you to say things like "my life will never get better." I want you to say things like, "Right now, things are not going so well in my life, but in a few days or a few weeks, with a lot of work and a lot of help from my friends and family, they will get better."
So to be optimistic.
Yes, 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 and not focus so much on the negative. I want you to learn that to feel good about doing a good job, even if it's not perfect. Okay, we all have some flaws, we all have some faults. Nothing's going to be perfect, and I want you to accept yourself for doing a good job and for trying the best you can. Okay. I want you to take a break from stressful situations, whether it's going to see friends or going to a movie, picking up a good book, anything you can do to distract yourself from a stressful situation is helpful. Sometimes I think that just taking a walk is a good idea, okay? Just pick up, put on your tennis shoes and go for a walk. Of course, tell your parents you're leaving. Don't leave
Right.
without telling your parents, right?
Kind of to like break away from it all, get away
Yes.
from it.
Yes. Exercise is critical in managing stress. It's so important. If you're not exercising regularly already, I want you to please find time to exercise. My goal is to find 5 hours during the week where we can do some form of exercise. 1 hour one day, 1 hour another day, maybe half an hour another day, but add them up to 5 hours where you're doing some form of exercise, okay? And in addition to that, I want you to build a network of friends and family that are very supportive and helpful so that they can help you manage your stress. People who can listen to you, support you, understand you, and not judge you.
And well, that exercise point it is very important, I consider. And is there any sort of specific exercise you think they should do? Aerobic, walking, running, that sort of thing, basically?
Yeah, people respond to different exercises in different ways.
Mm-hmm.
Some people like to do more aerobic activity like running or walking, and because it helps them release whatever is stressing them out. But some people respond better to more calming exercises like yoga or stretching, or maybe sitting in meditation poses. So whatever works for you works for me, but I want you to do it.
Right, so they just have to try to see what works for them.
Exactly.
Do you have any other advice for teens who are very stressed out, or friends who think their friends are stressed out, or even parents who think their teens are stressed out?
First of all, it's normal to be stressed out, okay? Secondly, if you're feeling like it's too much stress, then please consult a psychologist and get some help on board so that you can at least feel like you're managing your stress better. And if you're a friend or a parent of a teenager who's very, very stressed and you think that their reaction is abnormal, push them to go see a psychologist. Have them go get some help.
Okay, well, thank you so much, Dr. Shaket, for being here on this program.
Thank you for having me.
We hope you keep all of this in mind. Don't forget to like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel. Have a great day, everyone.
Bye-bye.